Hi, morning.
Morning.
Hi. So, can I know your name and age, please?
My name is Fatimah,
Fatimah.
22 years old.
22 years old. I see. Where do you come from?
I'm a student. I'm studying in UPM.
UPM student. I see. Alright, so I'm Dr. Arfan, and I'll be attending you today. So, can you please tell me how can I help you?
I had chest pain for past 3 days, and it's very disturbing me, and I'm quite worried about this pain. I couldn't even sleep properly in these past 3 days.
I see. So you've been having chest pain for the past few days, and it's been disturbing your sleep pattern, is it?
Yeah.
Right. So can you please tell me more about this?
Yeah. Actually, the chest pain is almost at the center.
Okay.
And then I always feel the pain whenever I move around or whenever I breathe in deep. I take a deep breathe or it's mainly when something like whenever I move a lot
Okay,
or
I
like
see.
bend forward or something, it's always very painful.
So when you move, it kind of aggravates the pain, is it?
Yeah.
Do you take any painkillers, by the way?
No. Usually when I at this chest pain, I restrict my movement and then just stay, and then I put ointment, some like normal.
What about the severity? If I give a scale of 0 to 10, how would you grade it?
The second day and third day, I would say it's a 7. It's quite painful.
I see. So I'm going to ask some more questions. That be okay for you?
Yeah, sure.
Right. So did you have the pain? It's not center of the chest, right? Does it radiates to the arm or to the lower jaw?
Not really. It doesn't
Doesn't
relate,
really.
but the pain was like pressing and crushing kind of nature.
Okay.
Actually, I'm quite worried about this chest pain because my grandma had passed away because of the heart attack.
see.
So that's why I'm really worried about this thing. It's quite stressful for me.
I'm sorry to hear that. How long? How many years ago was it? When did she
was-
pass away?
10 years ago.
10 years ago. I see. I see. So that is your main concern right now. So
Yeah.
you're worried it might be something of the heart origin.
Heart origin, yeah.
Was there any sweating?
Sweating? No, I would say no.
I see. So mostly it aggravates when you are moving about, right?
Yeah, I do play softball.
Oh,
So
softball,
it happens like a few times at the field. It's a bit painful, but not like the past 3 days. I feel pain at the chest whenever I play softball. I would say last few weeks I played too much of.
You play too much softball.
Yeah, I just.
So you suspect that because you've been playing too much, that might be the reason for this.
Maybe because I already had the pain before that, right? Before these past 3 days, right? So I'm quite suspecting that.
Okay.
But then, because my grandma passed away because of that, so I'm worrying it could be the other thing. Just want to check it.
Based on the presenting symptoms and all, and your age, I would say that it's quite unlikely for you to have a heart condition at this age. Might be more to related because if you've been playing softball too much or perhaps doing some excess work, right? But then again, we don't want to miss out anything. We will still proceed with some investigations and we will further confirm for this diagnosis, right? Okay. So by the way, you're mentioning that you've been playing quite a lot and you've been stressful, is it?
Yeah.
So why are you stressful? Something bother you?
Actually, I played softball a lot because I'm stressed. I'm stressed because I got some issue with my roommate.
I see.
Yeah, there's some misunderstanding, so I couldn't sleep well, I couldn't study well, so I just get too stressed because the exam is very near. Then to relieve the stress, I just go play the softball a lot, like every day, almost 2 hours. So maybe yeah.
I see. So you've been having issues with your roommate, right?
Oh, by the way, doctor, can I get some recommendation letter for my college to change roommate? Because it's quite troublesome for me.
Have you tried to contact the college regarding this to do so?
I had, but they said it's not a strong reason yet.
I see.
So
yeah, sure. I can write a recommendation letter and I will pass it to you, and so you can arrange with the college perhaps. By doing so, it might help you with resolving this issue.
Sure.
So how have you been coping with this stress, by the way?
That's the only thing that I do, like playing softball. I just don't want to stay at inside the room. I just go out. And when I go out, the place I go is to play softball.
Very troublesome for you. Sorry to hear that too, by the way. Yeah. And what about your whole sense of well-being? You've been feeling
Maybe because I didn't sleep well, right? So just a bit tired, but the pain is more concern for me compared to the other
I
things.
see. I see. Okay. So yeah, I will write you letter, and we will this we will do some physical examinations, and also we do some further investigations regarding your chest pain. Are you okay with this one? Or do you have any other suggestions? In
Yeah,
mind
sure.
that
The
I can help with?
investigation include ECG, is it?
Oh, ECG.
Included, is it?
Yeah, yeah.
Then
We
I'm
do
okay.
ECG. Okay,
I'm
alright.
with it.
Yeah, so you're alright under the plan?
Yeah, sure.
Alright, sure. Alright, so yeah, and after this, you can make a push, do some investigations, and yeah, I think that's about it. Do you have anything else that I can help you with?
No.
No? Alright, so thank you very much, Miss Fatimah.
Okay, thank
Okay,
you.
so have a good day.
Thank you.
Chest pain is the most common and important cardiovascular symptom. It is also a very important symptom for the lungs and esophagus, where the character, pattern of pain, and associated symptom differ. Causes of chest pain can be divided into different body systems: cardiac, respiratory, gastrointestinal, musculoskeletal, and psychogenic. Chest pain can also be classified according to its character. Cardiac pain, which includes stable angina and acute coronary syndrome. Pulmonary pain are usually dull and constant. Musculoskeletal pain is often bilateral and is generally intensified by changes in body position. It is tender to touch and often is confused with pleuritic pain. Pleuritic pain is a pain from parietal pleura and endothoracic fascia. It is worsened on inspiration. Burning pain is usually associated with esophageal disease occurring frequently after eating. Acid reflux may be worsened with recumbency. Typical chest pain consists of substernal chest discomfort, which is provoked by exertion and is relieved by rest or nitroglycerin. Symptoms suggestive of myocardial infarction includes persistent chest pain, upset stomach, lightheadedness, shortness of breath, and excessive sweating. Investigations can be done to find the etiology of chest pain, severity, and also complications of the underlying disease. Acute myocardial infarction can be treated according to the well-known mnemonics MONA: morphine, oxygen, nitrate, aspirin, and clopidogrel. For more information, log on to the website of Armando Hasudangan Biology and Medicine videos.